clearer and more flexible laws for healthcare service providers to ensure there's sufficient safeguards so that patient safety is not compromised. Patients can expect this with the new Healthcare Services Bill passed in Parliament today.
The bill replaces the current Private Hospitals and Medical Clinics Act. Cheryl Go explains.
In a rapidly changing healthcare environment, where there is increasing prevalence of new technology, mobile, online and co-located services, the law has to ensure that governance systems are strong and regulatory clarity improved. The existing Act focuses on regulating healthcare premises. It has 4 fixed categories of licenses, with medical and dental clinics making up the bulk of the licensees. The Health Ministry is replacing this with the new Healthcare Services Act, or HCSA, to provide clear standards for services. Healthcare providers can opt to take up to 25 different licenses, ranging from basic hospital services to nursing home care and assisted reproduction. It also covers non-premise-based services such as private ambulance operators and telemedicine for the first time. This means these industries will have to comply with regulations that will spell out standards for things like training and capabilities.
This approach will better suit the business models of providers who will just have to take the licenses based on the services that they wish to provide. So, for example, a provider can decide that he wants to hold a suite of service licenses for a nursing home, for a clinic, telemedicine and health screening.
Mr. Tong added standalone allied health, nursing, traditional medicine and other alternative medicine services will also be governed by the bill, but they do not need to be licensed for the time being. MOH says the transition will be seamless and low cost. In fact, 95% of existing providers will see no change or even a decrease in fees. Only a small handful will experience an increase, and they are mainly providing new licensable services covered by the bill. The bill also spells out new safeguards to better protect patients. These include background checks for employees working with vulnerable patients to make sure staff who are known to have caused harm in one nursing home will not be able to work in another home. There will also be tighter restrictions for naming and advertising, as well as stricter rules around co-location of healthcare services in the same space. The changes under HCSA will be implemented in 3 phases till the end of 2022. MOH will also publish a list of non-compliant licensees and unlicensed providers to help patients make more informed decisions.